Final part of the conservative management of a rotator cuff or some kind of shoulder injury is largely going to be centered around discharge criteria. Now, we can probably all agree that there are two very, very different population subtypes when we think about either Gen Pop, okay, so people who maybe don't have any sport-specific demands, who are recreationally active. Obviously, there are still some things that they have going on, but it's very, very different from the sport-specific demands, the people that need to, deliver or absorb contact, the throwing athlete. So, Zach, if you kind of had to speak in generalities about each of those population subtypes, what things are being emphasized in later stage rehab, and what are some of these exit criteria that you're looking for?
Definitely, and I think we have two different populations that we're working with here, but the beginning stages are the same with all of them. So I think when we look at our exit criteria, it's not a matter of having two different tracks that we're taking people down, but they're going down the same track. It's just how far down that track are we going when we talk about that rehab to performance continuum. So I think with either one, you need to start off with your basics. Do we have their symptom profile under control? Do we have their traditional orthopedic landmarks under control? Meaning, have we restored range of motion? Have we restored strength from what we would consider like our PT school or orthopedic clinical exam? And then after that, it really goes down into, are we meeting the demands of what we're going to encounter either with our daily life, our occupation, or our recreational environment? And I think this is where you get into more what we would consider our kind of quote unquote functional testing. So examples of upper extremity functional testing that we utilize in the clinic could be something such as a closed kinetic chain upper extremity stability test. We could have an upper extremity Y balance test. We can do our medicine ball throws. We can do just different strength-oriented metrics in regards to monitoring what they're doing in the weight room and comparing that to their pre-injury status or maybe other peers if they're in an athletic environment. And then we can even go further down the rabbit hole and see, have we exposed them in the clinic to things that meet the demand of either their sport or their occupation? And when I think of occupation, we may be talking about maybe like a tactical athletes. Maybe we have fire department, we have police, we have military, or it could be somebody who has an occupation with just a highly specific or highly repetitive task or list of demands, and we need to find ways to mimic those. And there's not always a perfect testing environment for that, but I think you at least need to check off the box and say that you mimicked something in here, they demonstrated competence with it, they reported that they were comfortable with it, and the manner in which you completed it, either with the resistance utilized, the duration of the task, or the repetitions, is logical and comparable to what they're going to encounter.
I think of two things when I think also of the difference between the two, largely specificity of movement and then rate of force development. So the need to actually, in a sports-specific standpoint, like generate force at specific speeds or specific rates. The people that are more Gen Pop probably need an emphasis on push, pull, carry. Those are things that probably are pretty basic for a lot of different people. The ability to have a joint distracted would come into play with your carries, most carries, at least at the side with regards to a suitcase or a farmer's walk, your ability to handle compression, hand on ground, obviously a little bit more through pushing. But then when you get to the sport-specific aspect of things, how are you looking at contact sport athletes and throwing athletes in particular?
Absolutely. I think if you have a throwing athlete, if we're talking about like baseball throwing, there's obviously interval throwing programs that you can go through. But if we're talking about other means of throwing, so whether it's with a lacrosse stick or a football or just other ways to throw in general, we look at the demands of that, which you had just mentioned. It's a heavy distractive force happening at the shoulder at a high rate of speed at sometimes very unique or awkward positions. So I think you probably, other than just asking them to throw, which is probably the most specific way to go about doing it, preceding that, you're probably doing different things such as medicine ball throws to mimic some of the velocity and the intent that you need to do with the distractive nature of that. From an impact standpoint, this is where I like to go through a falling series with them. So having them practice catching themselves. So maybe you're positioning them in front of a table, letting them fall to the table and catch themselves. You can also do that from the ground, and you can have them go from their knees. And ways that you can modify that is modifying the amount of time that they have to absorb. So maybe we're letting them catch and absorb all the way through a full range of motion versus catching and immediately presenting stiffness upon contact. You can also do that from a straight ahead position. You can do it from maybe like a diagonal or a sideways position, and you can influence, do we have two hands catching ourselves or one hand? But I think between different throwing mechanisms with the medicine ball, different falling and catching mechanisms, that's a good way to look at the ability to tolerate impact and the ability to tolerate, which would be more compression, and the ability to tolerate distraction at the shoulder without just trying to specifically mimic the task of throwing or getting hit in a game.